Welcome back. You have had that session where your client says, I know I should go outside more. I know exercise helps. I know isolating makes it worse. They know, but they are not doing. And as therapists, we sit there wondering, how do we help clients moving from awareness to action, especially in depression? Today, we are breaking that down clinically, practically, and compassionately. Let's start with something fundamental. Depression is not a knowledge problem. It is an energy, motivation, and reward system problem. In conditions such as major depressive disorder, clients often experience low energy, functioning difficulties, and hopelessness about outcomes. So when a client says, I know what to do, but I cannot motivate myself, they are not being resistant, they are neurologically depleted. Insight lives in the prefrontal cortex. Action requires motivational and reward system to cooperate. And in depression, the system is offline. So our job is not to increase insight. Our job is to stimulate action despite low motivation. One of the most evidence-based treatment for depression is behavior activation. And here's the core philosophy. You don't wait to feel better in order to act. You act in order to feel better. This is radically different from how depressed clients think. Depression says, when I feel motivated, I will start, and I won't start until I feel completely motivated. And behavior activation says, start first, motivation will follow. As therapists, we must gently but firmly shift the perspectives for the client. There are 6 clinical strategies to move client from awareness to action. The first step is about validating the gap without reinforcing it. Instead of questioning the client, so why are you not doing it? We validate. It makes sense that knowing it and doing it feels worlds apart right now. The step reduces shame because shame kills activation. The second step is to decrease the task until it feels almost too easy. Depressed brain perceive tasks as way heavier than they actually are. When clients set a goal that I will go to the gym 3 times a week, in reality, they haven't even left the room for the past 5 days. Instead of aiming for big goals, we scale it down to put on the running shoes, step outside for 2 minutes, and walk back and forth to the mailbox. Tiny actions are better than no action. Action builds confidence, and confidence develops momentum. The third step is separate mood from behavior. In order to do so, we help clients understand their mood is not a prerequisite for movement. I often say that to my client. You don't have to feel like that. You just have to do it gently first. In this way, we are decoupling emotional readiness for behavior initiation. And the fourth step is about using implementation intentions. Instead of vague goals such as I will go for a walk, we use the SMART goals to help them setting up specific goals, which includes when, where, and how long. The more specific the task is, the less executive load requires. And the fifth step is to address avoidance. In order to do so, we ask the client, what is staying in bed protecting you from? What fear shows up when you think about calling a friend? Which thinking says that it won't matter anyway? Sometimes the barrier isn't about energy, it's about fear toward change and hopelessness. And hopelessness needs cognitive work alongside behavior activation. And the final step is to reinforce progress, not outcome. So they worked for 3 minutes instead of 10 minutes. Even that is a success. We reinforce progress and effort, initiation and showing up, not the performance itself. Because depression itself already tells the client that they are not achieving enough. What to do if action still doesn't happen? If nothing shifts, we need to consider if severe depression requires medication referral. Are we dealing with concurrent medical health disorder where there's something beyond depression? Is client's goal aligned with their values? Are we moving in a pace that is too fast? Sometimes what looks like resistance can be nervous system shutdown, executive dysfunctioning, or unresolved trauma or grief. In those cases, we need to slow down, not push harder. Here's something we can say. I don't need you to change your whole life this week. I just need you to test one small action that challenges depression's prediction. Behavior activation is essentially running experiments against depressive predictions. Ultimately, moving from awareness to action in depression is about helping the client understand that feelings are not instructions, thoughts are not always factual. Motivation can be unreliable from time to time, and action can come first. And sometimes, the most brave thing that a depressed client does all week is to simply show up to their counseling session. We must see it, name it, and honor it. If you are a therapist feeling stuck with they know it but they're not doing it, your therapy session is still effective. Depression is heavy. Your role is not to push insight. It's to gently engineer conditions where action becomes possible. And remember, tiny movements create psychological momentum. If this was helpful, let me know in the comments.